Hello and welcome to my presentation. My name is Shannon McClam and this project is based on time management and professional behavior in nursing. Throughout this presentation, we will do an active case study involving 8 patients and several staff members to which I will be acting as the charge nurse. It is my responsibility to assign these patients, delegate proper tasks, and explain the benefits of delegation, time management, and professionalism throughout. For the first patient assignment, we have Amelia. I assigned Amelia to Alex and Francis. I chose Alex due to the complexity of Amelia's case and what the current orders are for her. Alex has been a nurse for over 15 years, with the first 12 of those years in a labor and delivery setting. Because of that background, I feel certain that Alex has administered blood products previously. It is not uncommon for a labor and delivery patient to require a blood product transfusion during their stay, whether it is due to an anemia or a post-delivery hemorrhage. I chose Francis for this case due to their level of expertise. Francis is a NA Level 2 with 3 years of experience. This advanced certificate gives me the reassurance that Francis can assist with the sterile dressings changes. Francis will also monitor the vital signs and IV pumps for any alerts or changes in condition and immediately alert them to the RN. Lastly, Francis will obtain blood glucose checks due to the patient's medical history and assist with activities of daily living. Patient 2 is Jethro. I assigned myself and Francis to Jethro's case. I chose myself due to the extensive med-surg experience that I have. Jethro is on a ventilator, in severe pain, and appears cyanotic. By all standards, Jethro is not in a stable condition. His past substance abuse has likely caused him to develop a tolerance to the pain medications that we are supplying. Adversely, we can't simply increase his opioid medication doses for risking respiratory depression in a patient who is already struggling with the ventilator. With my more than 10 years of experience in a med-surg setting, I feel that I am the best fit for this patient. I chose Francis again due to their experience and advanced certifications. Francis will be able to assist the nurse by monitoring both the IV pumps and vital signs for changes and alerting me if any are indicated. Francis will also assist Jethro with activities of daily living. I assigned Logan and Charlie to Jason's case. Logan is an LPN and has been for over 20 years. To say that Logan could not handle a more complex case due to experience will be far from the truth, but legally, Logan is restricted on certain tasks. Jason is a stable patient that does not require constant assessments or interventions. His current orders dictate that he has a one-on-one sitter and that he should be monitored for safety and comfort until admission to another facility. Should anything change in Jason's condition, Logan would alert the charge nurse, which is me, of the change so that I could then intervene and assess Jason for further treatment. Charlie was chosen for this case due to the lack of experience. Charlie has recently finished the required orientation at our facility, and Charlie will act as the one-on-one sitter for Jason. I did not choose one of our other staff members because they have all gained more experience than Charlie and can therefore assist the other nurses with the high acuity that we have on the unit today. Next we have Gertrude. I assigned Logan and Shelby to this case. Again, being that Logan is restricted by policy on the tasks that can be performed by an LPN, I assigned this patient due to how stable Gertrude is. She is potentially a critical patient, but is scheduled to have a pacemaker replacement in the morning. For now, her orders are simply to maintain NPO status throughout the night, maintain oxygen saturation, and report any changes noted on telemetry. If any changes were noted, the charge as well as the provider will be notified by Logan. Shelby is assigned to Gertrude for a couple of reasons. Shelby has 6 years of experience and is a nurse aide level 1. Assisting Gertrude with activities of daily living, monitoring vital signs for changes, and assisting the patient to the bedside commode are all well within the scope of practice and expected experience level for Shelby. Here we have Jenny, which I assigned myself and Shelby to this case. I chose myself due to the complexity of Jenny's case. She is awaiting surgery to repair a fractured femur in the morning. However, upon our assessment, it is evident that Jenny is suffering from compartment syndrome due to the cast that was applied to her leg in the emergency department. This condition will require immediate action by experienced personnel to prevent further complications. I chose Shelby for this case due to the requirements of the patient. Other than treating the compartment syndrome, Jenny's acuity is lower than most of the patients on the unit. Shelby would be assisting Jenny to promote comfort until surgery in the morning. She would also monitor Jenny's vital signs, IV pumps, and overall condition for changes and report them to me immediately if they are found. Next, we have Kara. I assigned Pat and Shelby to Kara's case. Pat is a fresh nurse on their first shift without a preceptor. I want to assign patients to Pat that require the care of an RN but are not so complex. Kara, by my standards, is a stable patient. According to the report, she can be a bit needy and require more attention socially than other patients, but medically speaking, she has a low acuity, which should not be an issue for Pat. I assigned Shelby to Kara as well. Being that Kara is fairly stable and who is on the recovery side of her stay, I feel that Shelby would be a great benefit to her case. Shelby can assist Pat by regularly checking Kara's blood glucose levels to wean her off of the insulin drip. She can also assist with patient care and activities of daily living for the patient. Here, our patient we have is Cheryl. I assigned Pat and Shelby to this case. Again, with Pat being a new and inexperienced nurse, I do not want to assign a case that is very complex and would require years of experience to properly handle. This would be dangerous for both the patient and the nurse. Cheryl is recovering from a TIA, but is showing new signs of confusion. It's the job of an RN to evaluate these changes in mental status and report them to the provider as necessary. This should be well within the wheelhouse of a RN, even if they are inexperienced and new to the job. Shelby is also assigned to Cheryl. This is her last patient for this shift. She does have one more patient than Francis on the shift, but that is due to the complexity of Francis's cases as well as Francis's level of expertise. Shelby will assist the patient with activities of daily living to include elimination needs as well as self-hygiene. Shelby will also assist Pat by keeping Cheryl NPO until the speech therapy team can assess the patient for swallowing abilities. And for the last patient, we have Jamie. I have assigned Alex and Francis to Jamie's case. I chose Alex both for this nurse's experience and status as an RN. Jamie currently has a chest tube in place due to a pneumothorax. Alex will need to constantly assess the chest drain to ensure that the tube is intact and suction is maintained in order to prevent backflow, which would lead to further complications. Francis is assigned to Jamie due to Jamie's complex condition. I feel that a level 2 NA would be a better fit for a patient who is at such a high risk for infection as well as complications, such as a dislodged chest tube. Francis will assist Alex by monitoring vital signs, oxygen saturation, and IV pumps and telemetry for any changes and report them to the nurse immediately. As defined by Merriam-Webster, professionalism is the conduct, aims, or qualities that characterize or mark a profession or a professional person. Professionalism was used in the assignments of cases to staff members to ensure that the best care will be provided to each patient. Education, experience, and competency are all important attributes that make up a nurse's professionalism. The question was asked if additional information was provided about each patient. Would the staff assignments change? For half of them, yes, and half of them, no. I will go into detail about each patient now. For patient 1, Amelia, no changes would have been necessary. Alex has been in nursing for over 15 years, and I feel confident that Alex would have been able to handle any changes in condition that this patient may experience. For patient 2, we had Jethro. If any additional information was provided for this patient, no changes would have been necessary. I have the most med-surg experience on the unit, therefore I feel that I would have been able to handle any changes in condition that my patient would have experienced. For patient 3 was Jason. If any additional information was provided for Jason, the staffing assignments would have changed. Though Logan has the most years of experience on the unit and in nursing altogether, being an LPN limits the abilities and tasks that can be performed by that individual. If additional information was provided for Gertrude, our patient 4, that staffing assignment would also have changed. Again, Logan is an experienced LPN who is only limited by the licensure that they have. Gertrude at the moment is stable, but if the telemetry strip was reading something other than a sinus rhythm, or she required a cardiac drip, then the patient would have been outside of the scope of practice for Logan. If additional information was provided for Jenny, no changes would have been necessary. With over 10 years of experience in med-surg, I feel that I could adapt to the changes that may have been presented with this patient. If additional information was provided for Kara, the staffing assignment would have changed. Pat was our new nurse. This is their first solo shift without a preceptor. It would have been irresponsible of me, the charge nurse, to assign a new nurse to someone who has a very difficult and complex case that could only be understood and properly treated from years of experience. If additional information was provided for Cheryl, our patient 7, the staffing assignments would again have changed. Again, with Pat being a new nurse to the job, it is best practice to assign less acuity patients when possible so that the nurse can gain the experience and confidence needed in their practice. If Cheryl was presenting to the ED with a possible TIA in progress, then I feel it would have been appropriate to assign a veteran nurse to this case. And lastly, if additional information was provided for Jamie, our patient number 8, no changes would have been necessary. Alex has the most years of experience as an RN on the unit. Though a chest tube is a serious intervention, it is well within the scope of practice of an RN with the education and years of experience as someone like Alex. The orders for Jethro are listed here. However, this is not everything that is involved when caring for a patient. Listed under the orders, I have compiled a list of tasks that should be completed while providing care to Jethro throughout his treatment. The tasks were not listed as direct orders from the provider, but are part of the standard of care for most patients in a hospital setting. They are as follows. Provide mouth care to the patient, because this has been proven to improve the prevention of ventilator-associated pneumonia, or VAP for short, in patients. Turning the patient every 2 hours to prevent skin breakdown. Strict measurement of input and output. Activities of daily living to include bathing and elimination needs, and careful monitoring of the patient's vital signs, oxygen saturation, and IV flow rates. Again, you will find the current orders listed first on this slide. These are what are ordered for the patient directly from the medical provider. Under the provider orders are a list of essential tasks that need to be completed to promote safe and thorough treatment of the patient. Due to the patient having a scheduled surgery in the morning, it is imperative that the patient follow the NPO guidelines. Monitoring the patient's input and output and assisting with ADLs such as bathing and elimination needs are also important to provide. Monitoring vital signs for changes in condition and repositioning the patient in bed to promote comfort and prevent skin care are all essential tasks that should be performed without an order. It is important to delegate simpler and non-critical tasks while nursing, especially when the unit has such a high acuity as this one. The nursing staff must all work together for the betterment of the patients. As stated by Sarah in one of the videos linked, there are tasks that must be performed by RNs due to them being outside of the other staff's scope of practice. Delegating tasks that can be performed by other staff members, such as ambulating to the bathroom or providing bed baths, allow the RN more time to focus on the critical aspects of that patient's care and treatment. Here we will discuss the sequence in which I will complete the orders provided by the healthcare provider. To start, we will start with our patient Jethro. The first thing I would do is assess the ventilator for alarms. I would then assess the tubing for leaks or kinks. And because the patient is unable to speak, you must rely on objective data, such as the cyanotic coloring, to determine that there is poor oxygenation reaching these areas. Next, I would adjust the flow rate of oxygen to 100% prior to suctioning. This is so that we can hyperoxygenate the patient. Suctioning the patient's airways is next. We do this to remove any secretions that may be obstructing the airflow within the trachea. If conditions do not improve, I would then notify the respiratory therapist on the case. Only the respiratory therapist can adjust the settings on the ventilator. Next, I would reassess the vital signs to see if oxygenation has improved. I would then start the normal saline solution at 50 milliliters an hour per provider orders. Next, I would check the medication administration record, or the MAR, to see if the patient is eligible to receive more pain and anxiety medication. If indicated, I would administer the medication. I would then notify the provider that the IV pain medication is ineffective at reducing the pain level for the patient. Next, I would schedule the patient for X-ray of chest to reevaluate for pneumonia. And lastly, I would communicate with the nurse's aide that I have assigned to Jethro to ensure that all activities of daily living and other delegated tasks are being completed. For our next patient, we have Jenny. The sequence in which I will complete the orders are as follows. First, we would assess the patient and focus on the injured leg. Again, Jenny is the one with the fractured femur who we believe is suffering from compartment syndrome. So next, we would notify the provider of our findings and that we suspect compartment syndrome in that injured leg. Next, we would remove the cast per the provider's new orders to alleviate the pressure until that provider can arrive to assess the patient. Next, we would continue with the MPO status until surgery and communicate with the nurse's aide to verify that all ADLs and other delegated tasks are being completed for the patient. It is the responsibility of the registered nurse to make sure that all care is being provided to their patients. The accountability is not passed along when the task is delegated. During this assignment, there were many tips and tricks that I learned and witnessed during the videos and read in the articles provided and along with my own research. Time management is crucial to being a nurse. Time management is an essential skill to have while nursing. You can become overwhelmed in a matter of minutes if you do not properly plan your day. Having the skill set to efficiently care for patients will not only provide a safer and more comfortable environment for them, but it will also promote a healthy relationship between the nurse and their job. As stated by Sarah with registerednursern.com, you have to use every hour efficiently if you want to be successful in this career. Some of the tips that I also read along besides her video, they include coming to work early. That was by Nurse Mendoza. He suggested coming to work 15 minutes early, asking questions during report, and setting hour by hour goals for your shift.